Hello everyone. Today we will be talking about deep vein thrombosis. So before we understand the topic, we need to know what thrombosis means. So thrombosis basically refers to a blood clot forming in the vessels. So during the operative and post-operative period, the patient has an increased predisposition to venous thrombosis in the veins of the calf muscles and pelvic veins. So as you can see, these are the deep veins of the leg. Normal blood flow is what's shown on the first picture. Then under deep vein thrombosis is whereby, as you can see, there is a clot that has formed, and on the third picture is whereby part of a clot has moved from the thrombosis and it has embolized. Okay. So deep vein trouble. So leg veins contain small valves that help keep blood moving towards the heart. Injury, immobility, and other factors can lead to the formation of a blood clot. Inside a leg vein, this is called a deep vein thrombosis. Sometimes a piece of the clot breaks away, which is called what? An embolus, and enters the circulation. If it lodges in the lungs, it can cause a potentially deadly condition called pulmonary embolism. So the predisposition to deep vein thrombosis has got three main components, which are also referred to as Virchows TRIAD. So the first thing is increased thrombotic tendency, which is basically platelets and fibrinogen increased. Changes in blood flow. Increased stagnation due to immobilization. Then the third thing is damage to the vein wall. Damage to the endothelium due to inflammation or pressure of the mattress against the calf. So this is a diagram just to show the Virchows triad. So basically the stasis, vessel wall injury, and hypercoagulability. So what are the causes? What can cause venous stasis? It can be atrial fibrillation, obesity, immobility, pregnancy, basically anything that leads to what? Stasis of blood. Endothelial damage. What can damage the endothelial cells? It could be due to trauma, external pressure, or IV caustic substances. Then the third parameter is hypercoagulability of the blood. So that can be due to hematologic disorders that can lead to increased platelets, so polycythemia, severe anemia, malignancies, sepsis, use of contraceptives, and smoking. So this is basically another diagram just mentioning the causes of the predisposing factors. So what are the clinical features of DVT? So there will be pain in the calf. On examination, there will be tenderness of the calf and swelling of the foot. There will be edema, raised skin temperature, dilatation of the superficial veins of the leg, mild pyrexia. If pelvic vein or femoral vein is affected, there is massive swelling of the whole lower limb. And then the treatment is anticoagulant therapy with IV heparin infusion or subcutaneous low molecular weight heparin. Once coagulated, mobilize the patient with lower limbs supported in elastic stocking to prevent edema. Pulmonary embolus. So as we talked about it, one of the complications of deep vein thrombosis was pulmonary embolism. So when a clot forms from a vein, usually originating in the femoral or pelvic vein, occasionally in the calf muscles, it detaches and travels to the heart to become lodged in the pulmonary arterial tree. So as we have talked about it, from a deep vein, it goes up and then it lodges into the pulmonary vein. So what are the risk factors for pulmonary embolism? This has a mnemonic called thrombosis. So T, trauma, travel, thrombophilia. H, hypercoagulable state, hormone replacement therapy. R, recreational drugs, IV drug use. O, old age, then malignancy. B, birth control pills or patches or obesity. Obstetrical causes such as pregnancy, which is pregnancy up till first 6 weeks postpartum, as surgery, immobilization, iatrogenic, and then as serious illnesses. What are the clinical features of pulmonary embolism? So it usually occurs around the 10th day post-op. It presents with dyspnea, mild, moderate, or very severe. May be accompanied with cyanosis and shock. May be sudden or progressive. Then they'll also present with mild pleuritic pain, hemoptysis, and they may also present with sudden death due to occlusion of pulmonary artery trunk. And then on examination, you'll get tachypnea with a spike of fever, raised jugular venous pressure reflecting pulmonary hypertension. They may present with cyanosis if the clot is large. Diagnosis is often difficult, the main differential diagnosis being myocardial infarction, because as you have seen, the clinical features are very similar to myocardial infarction, and a small emboli may be confused with chest infection. So the signs and symptoms, we've got chest pain, dyspnea, apprehension, cough, hemoptysis, diaphoresis, syncope, cardiopulmonary arrest, palpitations, chest tightness. Signs, we've got tachypnea, which is respiration above 16 beats per minute, tachycardia, pulse above 100 beats per minute, hypotension, gallop rhythm, then rails, temperature above 37.8 degrees, phlebitis, diaphoresis, edema, murmur, cyanosis. So what are the investigations that you can do? You can do a chest x-ray, ECG to differentiate with myocardial infarction, arterial blood gases, and computerized sonographic pulmonary angiography. So what's the treatment? You can give opiate analgesia, oxygen to assist with the breathing, heparin to break down the clot, and to prevent coagulation, streptokinase to lyse the embolus via pulmonary catheter, and pulmonary embolectomy with cardiopulmonary by bypass may be successful. So that's all about DVT and pulmonary embolism. So if you like the video, please like it, subscribe, and comment. Thank you.